Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about carpal tunnel syndrome. First, we're going to talk about anatomy of the wrist. You have wrist bones or carpal bones that make up 3/4 of the wrist. So if you think of a U shape made out of little rocks or bones, the bottom is bones, the sides are bones, and that creates a U shape of the wrist. The top of that is closed off with a ligament tissue called the flexor retinaculum, and between the three sides of bones and one side of this tissue, we create a rectangle-shaped box that your tendons and nerves go through. So if you've seen the Terminator when he gets his arm cut open and he goes like that, and you can see these little rods sliding back and forth in his forearm, that's what the tendons literally look like in your wrist, and these tendons slide back and forth inside of this rectangle-shaped box. You unfortunately have one of your nerves called the median nerve that's also crowded into this box. So when you have inflammation of this box, there's no place for the swelling to go. These tendons will get puffy and they'll actually pinch on the median nerve. There's three nerves that go through the wrist: the median nerve, the radial nerve, and the ulnar nerve. The median nerve is inside of this box. The radial and ulnar nerve are outside of the box, so they're not affected by carpal tunnel syndrome. When you get carpal tunnel syndrome, you get pain or numbness or tingling in the distribution of the median nerve. So that particular nerve innervates 3.5 fingers. So thumb, first, second, and then the thumb side of the fourth finger are innervated by the median nerve. The ulnar nerve innervates the pinky and the pinky side of the fourth finger. So a good place to start with deciding if it's carpal tunnel is going to that ring finger and seeing if it's numb or symptoms on just the thumb side of it, and it's likely carpal tunnel syndrome. We can elicit symptoms by two tests called Tinel's and Phelan sign. So tapping on this box, if it causes tingling or electric signals into the hand, that's a positive Tinel sign and indicative of carpal tunnel syndrome. We can bend your wrist and hold you there for a minute, and if you go numb, that's called Phelan sign, and that's also indicative of carpal tunnel syndrome. When you have hand symptoms, it's not always related to the wrist. You can have pinched nerve at the elbow. So if you're sitting in a chair, in a car, at a game council, and you're resting on your nerve at your elbow, there's two different nerves in the elbow, and these can get pinched as well, and those will refer pain into the wrist. That's a little bit different symptoms. It doesn't cause discomfort when we tap on the wrist. It does cause discomfort or symptoms like funny bone when we tap on your elbow. Treatment of carpal tunnel syndrome, the first treatment is to put you in a wrist splint that keeps your wrist straight. So if you think of these ligaments and nerve going through the wrist, when you bend your wrist like that, that pinches at the wrist. So we wear a splint to keep your wrist straight, and ironically the most important time to wear it is bedtime, because when you go to sleep you actually will curl your wrist like this, so you have to wear your splint at nighttime to keep your wrist straight. This can be helpful. Icing the area can be helpful. Decreasing the thing that you're doing that's overuse. So if you're at a computer or playing a video game or doing some type of manual labor and you're repetitively using your hand, then you want to decrease that activity as well. We do cortisone shots into the wrist. Sometimes we do a surgical procedure where they will go in and they'll cut this flexor retinaculum or the tissue on the top of the wrist and make it a little bit looser to give room inside of that little box. So carpal tunnel syndrome, if you do have it, you want to decrease the event that's causing it. You want to see your doctor fairly promptly, because the longer you have a pinched nerve, the more irreversible symptoms you have. So if you have it for a long time, go see the doctor and he fixes the pinch, your nerves may be chronically damaged. Wearing a $12 wrist splint would be a good first step before you go to the doctor, taking ibuprofen if you can. Dr. Greg Castello, thanks.